Hello, my name is Lois Richards, and this presentation will be on nurse burnout. This project will take place in a large metropolitan hospital among novice and experienced nurses in the progressive cardiac care and family centered care units. I will endeavor to develop relationships with the employees and learners by showing respect and valuing each person's perspective and expertise in their field of practice. So, what is the problem? Nurses are exiting the profession due to stress, fatigue, dissatisfaction, complacency, lack of fulfillment, and lack of coping strategies, causing a concept called nurse burnout. Let us review the data on the effect that burnout has on nurses. Research confirmed estimates for nurses who experience burnout range from 33 to as high as 70%. Research also showed that 5 to 50% exhibited symptoms of burnout depending on the specialty and geographic location. 34.1% exhibited extreme emotional exhaustion. 12.6% exhibited depersonalization. 15.2% exhibited low personal accomplishment, and 15% had expressed remorse over their career decision. In addition, each additional patient on a nurse's caseload raises the risk of burnout by around 23%. Therefore, this data reveals an overwhelming concern and need for this project. The two learning objectives that will guide this project are that one, the learner will describe the signs and symptoms of burnout and its effect on the physical, emotional, mental, and spiritual body. Two, the learner will apply effective self care practices and coping strategies to address and decrease nurse burnout, thus improving nurse retention in the hospital. The educational theory that will guide this project is the novice to expert theory. Patricia Benner developed this theory in 1982. Benner's theory states that the development of the nurse will go through 5 stages: the novice, advanced beginner, competent, proficient, and expert stages. Beginning at the novice stage, the nurse has no experience practicing self care and developing coping strategies. However, at the expert stage, which is the goal, the nurse's performance is holistic rather than fractionated, procedural, and based upon incremental steps. The expert nurse has developed resilience and is practicing self care and healthy coping strategies daily. Gene Watson's caring science theory will guide this teaching project. The theory was developed in 1979. The theorist pointed out the deep connection between love and caring. The theorist commented that this relationship creates an opening, alignment, and access for inner healing for self and others. Achieving this state of being will provide a space of emotional balance needed within oneself and others to prevent stress and burnout. We find and reinforce that nursing, like teaching, is more than a profession when we incorporate caring and love into our work and daily lives. The theorists expressed that caritas, or caring nursing, or the caritas nurse works from a place of humanity. Even when a caritas nurse immerses into the necessary routine or dramatic, practical, technical world of clinical practices, this caring consciousness orientation guides their professional activities and interactions. I will incorporate caring attributes by authentically listening and being present, allowing for the expression of positive and negative feelings, being compassionate, showing no judgment, and creating a calm, healing environment. Let's take a deeper look now at nurse burnout. Nurse burnout is a condition of physical, emotional, and mental exhaustion or tiredness induced by an individual's diminished capacity to cope with their surroundings and is connected with higher turnover, team member absenteeism, inadequate colleague support, depersonalization, lower performance, decreased patient satisfaction, and trouble attaining and retaining staff. Burnout manifests as subtle, not sudden, changes in an individual's personality, viewpoint, beliefs, and attitude. There are 3 factors associated with nurse burnout. They are emotional exhaustion, which is defined as a chronic condition caused by high stress levels and exceeding expectations of delivering patient care in the contemporary healthcare setting. Depersonalization, which is defined as a sense of separation from one's work, and disengagement, which is defined as a lack of motivation and production. The author stated that these three factors result in poor judgment and increased risk of medical errors, the frequency of healthcare associated illnesses, and the chance for the nurse to leave the job or profession. It was mentioned that significant causes of stress and burnout include reduced staffing and increased workload. In addition to the increased number of patients to care for, the patient is also more complex. The decreased quality and time for patient care increases stress and may damage nurses' belief about why they chose to become nurses in the first place. It is imperative to teach nurses how to recognize burnout symptoms and build their resilience, coping strategies, and self-care practices. This project's most appropriate clinical teaching approaches will be one-on-one instruction and small group discussion. One-on-one instruction is a face-to-face means of dispensing information and will be an effective way of teaching because it facilitates individualized learning when the information is given and customized to the needs and goals of the person. Small group discussion provides an intimate, compelling, and interactive learning environment with up to 10 students. The teaching strategies of one-on-one instruction and small group discussion align well with the learning theory of novice to expert because the educator will teach the student how to apply learned skills to prevent burnout as a novice to expert. Gene Watson's care and science theory aligns with the teaching strategies because this theory promotes that a nurse must develop values such as faith, hope, compassion, inner peace, and self-care practices that transcend beyond self in a caring, healing environment. Asking questions through reflective writing is an appropriate evaluation strategy because it has been a long-standing education strategy used to enhance students' critical thinking skills, obtain self-knowledge and insight, and integrate nursing theory and practice in a safe space. This method will discover what the learner knows and allow for expressing feelings, thoughts, and emotions. Reflective writing aligns with the educational theory because it allows the learner to document and reflect on the learning concepts being taught and advance from the novice to expert stage. The reflective writing aligns with Watson's caring theory because the learner will have gained knowledge, insight, and critical thinking skills. Project implementation so far have included completing a needs assessment and literature review, and will create surveys, educational materials, and tools to discuss and implement self-care practices, coping strategies, and build resilience. This project will impact nursing education by teaching novice and experienced nurses how to identify burnout, the symptoms of burnout, the associated factors, and how to prevent burnout. Outcomes at the practicum site will assist nurses in understanding how and when to implement effective self-care practices and coping strategies. Also, how to build resilience to prevent burnout. This will have a direct impact on improving nurse retention in the healthcare setting. As a result of implementing these practices, patient care will improve. Patient care satisfaction ratings will increase. There will be an increased quality of patient care, safety, and time spent with the patient. The nurse will experience balance in their physical, emotional, mental, and spiritual lives that will positively impact the quality of patient care and their individual lives. In conclusion, burnout causes severe physical, mental, and emotional exhaustion and stress, which affects both the novice and the expert nurse. Too often, nurses allow the stressful working environment to be the driving force instead of creating that healthy, caring, and wholesome environment needed to have a positive existence in the nursing profession. Evidence shows that implementing self-care practices and developing healthy coping strategies will have lasting benefits for the nurse and build resilience to prevent burnout. Lastly, with the guidance of Benner's novice to expert theory and Watson's care and science theory, this project on nurse burnout supports the teaching strategies of one-on-one instruction and small groups and the evaluation method of asking questions in a reflective writing assignment.